I think as far as the landscape goes, there are fewer affirming cultural providers there. And what we're hearing from our community is that they're often traveling farther distances to obtain the care that they need. So one of the strategic aims of the center this year is really understanding how our community is accessing healthcare, affirming healthcare, and what are the barriers that might exist for them here in this rural area, whether or not that's sexual health testing, prevention, PrEP, access to PrEP, gender-affirming treatment, for example. We know that they're traveling at least an hour to get the services that they need.
The community health fairs are intended to serve our queer population we created emphasis around some of our 3 most vulnerable subpopulations. So we had a slew of community partners ranging from mental health care professionals to medical professionals to just community organizations that serve community populations. And we wanted to create a safe and inclusive space for folks to ask questions, be curious, find resources that maybe they wouldn't find necessarily on their own out in the world.
We've also seen members of our community talk about the challenges of not being able to connect to broadband. It also affects one's ability to access telehealth or telemedicine, or healthcare more generally, which is even more important in small, rural, and isolated communities because you're less likely to be able to find providers or resources to meet needs generally, but especially to meet unique needs if you are someone who has intersectional identities.
You will note that our queer population, whether it be nationally, but specifically in rural areas, they don't go to the doctor. They don't receive health care because they also just don't. There aren't a lot of folks creating or having affirming healthcare for them to access, right? So the idea is that we are at least opening conversations and doors and accessibility.
We are trying to build, again, a coordinated care network here in rural Shenandoah Valley. And to see people who are so enthusiastic and engaged and passionate about serving the community members here in all aspects, right? It takes a village, for sure.